I'm Dr. Sarmela Sunder. I'm a facial plastic surgeon in Beverly Hills, and I wanted to talk to you about skincare and plastic surgery with special consideration to the South Asian skin. So I kind of harnessed all the info that I have and international info regarding what are the most compelling interests for patients of South Asian descent. And so these are the topics: acne scars, pigmentation, under eye circles, plastic surgery within the South Asian population, wanting a simple skincare routine, wanting to know about procedures that are not safe in South Asian skin, and how South Asian skin ages differently than Caucasian skin. So I'm gonna be giving you a lot of info. Hopefully you have a pen and paper ready, and if you don't, this will all be included in the YouTube video, so make sure you subscribe. So first of all, as far as preventing acne, I know a lot of us as South Asians love our oils and want to use a lot of natural remedies and natural skincare. And while natural things are great, a lot of times when they're used in unintended uses can have negative side effects. So I've seen a lot of patients who are South Asian or otherwise who use coconut oil on their face and end up with severe acne as a result. So they're doing something hoping to improve their skin by using coconut oil, and in fact, they're actually ruining their skin and can lead to significant acne scarring. So beware of certain oils. And there are oils that are safe to use on the face, but coconut oil is definitely not one of them. The other thing that I commonly see is people ending up with hair products on their face. So it's really important to make sure that the hair products don't come too close to the scalp and remain off the forehead, off the face, and then try to limit any application onto the scalp. It's really important that when we use makeup, we try to use mineral makeup or products and makeup that are labeled as non-comedogenic, which means they are less likely to clog pores and less likely to cause acne. And this kind of seems pretty common sense, but it's really, really important that everyone washes their face every single night, regardless of whether you're wearing makeup or sunscreen or not. And everyone should be wearing sunscreen. I'll get into this later, but regardless of whether you have anything on your face during the day or not, it's really critical that you wash your face at the end of the day because we are exposed to so many pollutants and so many other oxidizing agents in the air that can cause damage. So it's really important to wash your face at the end of the day. So as far as treating acne in South Asian skin is somewhat similar to treating acne in Caucasian skin, with the caveat that we need to be much more gentle with our products. So a lot of products are very irritating to South Asian skin. We may not realize that it's irritating, and it may not seem irritating at first, and then we see the long-term ramifications of it years later. So as far as very mild acne or even mild to moderate acne, this can be treated by yourself. But if it's moderate acne or severe acne, I would highly encourage you to reach out to a dermatologist to help with managing the acne. So if it's mild acne, which is like little pimples, whiteheads, blackheads, things of that nature, a good retinoid is important to have in your armamentarium. So a retinoid can be, or it should be, prescription strength. So you can get a prescription for a tretinoin or Tazarac from your physician. But as of a year ago, there are 2 prescription strength retinoids that are available over the counter. Actually, the active ingredient is called adapalene. It comes in 2 brand names. One is Different, and I put them at the bottom of the slide. So Different Gel, and then La Roche-Posay has one called Effaclar. These can be purchased at Target or Rite Aid or any pharmacy. As far as starting with the retinoid, and I'll get into this in more detail later, but you want to start off slowly, once or twice a week, and then work up to pretty much every night. The second ingredient is benzoyl peroxide. There's so many over-the-counter benzoyl peroxide products out there, but it's very critical in South Asian skin to start off with very low doses. So I know a lot of us are overachievers. We're like, go big or go home. I'm going to go get the 10%, and that's the worst attitude towards benzoyl peroxide and a lot of ingredients, because it can actually be damaging to your skin and can have long-term negative consequences. So start with a low dose, which is 2.5%. Alternate days if the skin gets irritated, and you can work up to higher doses such as 5%. And you can save 10% for very, very rare occasions. And if possible, you should avoid very high doses. Finally, salicylic acid is another ingredient that is great for unclogging pores and for preventing new breakouts. Another ingredient that you want to use smaller doses of, 2%, works really well and is available in many over-the-counter products. So again, less is more. Don't overdo it when it comes to active ingredients. Don't try to use 5 different, don't use a retinoid and a benzoyl and a salicylic acid and a lactic acid and a glycolic acid. Try to minimize the number of active ingredients and try to minimize the dose as well. Particularly because in South Asian skin, irritation in the form of redness will eventually lead to brown spots or hyperpigmentation, which is different in the South Asian population as opposed to Caucasian skin. So next topic is acne scars. So there are 2 different presentations of quote unquote acne scars. What you're seeing here is actually not a true acne scar, but this is what a lot of women of color, men of color refer to as acne scars. This is actually post-inflammatory hyperpigmentation, and this happens with pretty much any skin of color when they have some sort of breakout, some sort of acne, that once the acne resolves, the red turns to brown or black spots. These are not scars. This is post-inflammatory hyperpigmentation, needs to be treated that way. So a good way to treat this is with retinoids, again, starting off slowly. And then there's certain spot brightening ingredients that can help improve the discoloration. So ingredients to look for are azelaic acid. Again, very high doses of azelaic acid can actually lead to hypopigmentation, leaving you with spots on your face that are significantly lighter than the rest of the face, which doesn't look good either. So you want to be careful about the dose that you use there. Mandelic acid is a very gentle acid that works well on South Asian skin to brighten dark areas. Vitamin C is a great ingredient to prevent brown spots and to treat certain brown spots as well. Vitamin C is very finicky in terms of how it's formulated, and it's very hard to get in a very stable formulation. So there are only a few products that have vitamin C that I'm a fan of because a lot of them aren't formulated well, and I'll get into that later. And then finally, hydroquinone, which is a skin lightening agent that should be used with extreme caution and under medical guidance. It can't be used for long periods at a time. And it should only be used in those areas, in specific areas. There's a lot of counterfeit hydroquinone on the market that has led to severe disfiguration of a lot of people of color, so be careful using that, and definitely do not use unless it's under the guidance of a medical professional. This right here, these are true acne scars. There are pits, there's depressions in the skin where the skin doesn't appear even. And this can really be improved at home using retinoids, because retinoids help with skin cell turnover and also with collagen production. Most of those scars are truly treated in the office. The best ways to treat these scars in an office are with medical grade microneedling, which should be done in a medical setting, either by a doctor, nurse, or a medical esthetician. You should definitely stay away from any at-home devices. A lot of patients with Caucasian skin can get away with doing at-home devices, which I still do not recommend for Caucasian patients, but definitely in patients with skin of color, these devices can lead to significant scarring of the skin, can lead to hyperpigmentation, can lead to streaking, and can actually thin the skin over time. So it's critical that you don't use these at-home roller devices. Another treatment that works well is fractionated radiofrequency, which is performed at a doctor's office. Definitely no lasers. There are certain lasers, when performed by someone that has a very high level of expertise with skin of color, are safe to do on our skin types, but that's so rare. I can count on my hand the people in the country that I would trust to do that on a loved one of mine. So I would definitely stay away from lasers. And then finally, depending on the scar, a lot of these scars can be filled in with filler, specifically into the scar so that the skin can look smoother. Okay, the next topic is hyperpigmentation. So one of the ways that South Asian skin ages is hyperpigmentation. So we may not wrinkle as quickly, but we hyperpigment much more commonly than Caucasian skin. So this is due to inflammation primarily. It can be as a result of acne, which is a form of inflammation. It is so critical in South Asian skin not to pick at your skin. So if you have a pimple, if you pick at it, you're introducing bacteria, but then you're also introducing, you're also encouraging more blood flow to that area, which can create more inflammation. And any time there's any inflammation, any pink, any red, that's going to turn into brown and black. That can take months to resolve. So definitely don't pick at your skin. UV rays can be damaging and cause hyperpigmentation. Using too many products and the wrong products. Again, keep it simple because the more your skin gets irritated, the more hyperpigmented it'll become. And then it's just a fact or a part of natural aging as well. So how can we protect or treat hyperpigmentation? Sunscreen. I know a lot of people that are not Caucasian feel like, well, you know, our risk of skin cancer is so low, we don't really have to use sunscreen. And while people of color and South Asians in particular have a lower risk of skin cancer, that risk is not zero. And people of color who do develop skin cancer have higher death rates as a result. So I don't want to completely discount that. But the more important reason for us to use sunscreen is to prevent aging, prevent hyperpigmentation. So especially when it comes to acne, a lot of people decide, well, when they're breaking out, I don't want to put anything on it. And that's the last thing you want to do is not put sunscreen on an area of active acne. You actually want to protect those red spots, those areas from the sun. So it's really important to use sunscreen at all times. A retinoid will actually, because of the cell turnover that gets increased as a result of using a retinoid, you will improve this hyperpigmentation over time. Hydroquinone, again, under the guidance of an MD, do not buy it on Amazon, do not buy it online. There have been so many cases where I've seen patients where they purchased something on Amazon and it was fraudulent, it was counterfeit, it was expired, it was an old form of hydroquinone that had other products mixed into it, and it has led to disastrous outcomes. So definitely do not buy anything counterfeit. And then other products that you may or may not have heard of that help with hyperpigmentation: azelaic acid, which I had mentioned before, kojic acid, also a gentle acid, mandelic acid, another gentle acid, vitamin C, arbutin, niacinamide, and cysteamine. And these are some products that people always ask me, well, which brand, which brand? There's really no one brand that I recommend for everything, but these are some over-the-counter, relatively inexpensive products that you can get that have some of these ingredients. The one that's not inexpensive is the SkinCeutical CE Ferulic. That's the vitamin C that I usually recommend for people that are not acne prone. So if you are prone to acne, this might make you break out a little bit. But if you have drier skin types or if you're not prone to acne, this is the best vitamin C on the market. This is the company that did the original research in vitamin C, and so they've really formulated in a way where it's protected and it's stable and it will last a long time. There's also new research regarding blue light exposure and people of color. So there's evidence that exposure to screens and exposure to blue light indoors can actually create photoaging, particularly in people of color. So one option is to limit screen time. My husband actually saw this slide and he's like, are you kidding me? You of all people are trying to give people that advice because he knows there's no way I'm going to limit my screen time. But if you can, limit your screen time. But then wear sunscreen even if you are indoors. I know it sounds crazy, but that's how you're going to limit any damage from blue light exposure. And the ingredient that you want to look for in sunscreen, particularly for blue light, is iron oxide. Not all sunscreens have that, and actually most sunscreens do not have iron oxide. These are some sunscreens that do include iron oxide. Iron oxide actually has a reddish tint to it, so pretty much every sunscreen that has iron oxide will be tinted. There are a couple of exceptions, but for the most part, they're tinted. So if you don't like tinted sunscreen, then iron oxide is not going to work for you. The way I work around it, if a tinted sunscreen is sometimes too light for me, I actually mix it with my foundation, or I'll mix it with a darker shade of foundation to make it more even tone, just to make it work. And then in general, what to look for in your sunscreen in general, you want to make sure it's a broad spectrum sunscreen, which means it has UVA coverage as well as UVB coverage. UVA is the rays that cause aging, UVB is for burn, and some hyperpigmentation also. So you want broad coverage. I prefer physical sunscreens or mineral sunscreens. There's no true chemical interaction that needs to happen in your skin in order for the sunscreen to work. The ingredients to look for in order to make it a physical sunscreen are zinc oxide, titanium dioxide, and then again, iron oxide if you want for blue light. If you don't, a lot of people don't like the white cast from the zinc oxide. There are some great formulations now, like the Skin Better Science one all the way on the right. Even though it has a high zinc oxide concentration, it actually blends in really well and doesn't leave a white cast. So there are a lot of transparent zinc compounds as well. It's really important that you reapply your sunscreen. A lot of people put on in the morning and then just forget about it and think that's it. The sunscreen really only lasts about a couple of hours. So if you're outdoors, you 100% have to reapply every couple of hours. If you are driving into work, working, and coming back, then you probably should reapply it before you get back in the car on your drive home. And what these mineral sunscreen sticks and sunscreen powders are a favorite of mine for reapplication. Next is under eye circles. So similar to acne scarring, it's a little bit of a misnomer because there are a few different conditions that people refer to as under eye circles. So in this patient, who's not a patient of mine, this woman has under eye circles, but it's due to fat. So you can see how there's a little bulge. She has a kind of a dark area and then a bulge and another dark area. That bulge is actually fat. The only way to, there's no skincare that's going to treat that. The only way to treat that is through surgery. So these are some patients of mine who underwent fat removal surgery under their eyes to smooth out that appearance of a dark under eye. And these surgeries are actually performed on the inside of the eyelid, so there's no visible scar on the eyelid skin, which is important for a lot of patients of color, especially South Asian patients who may not heal well from a scar. Next, this is another term for under eye circles, and the cause here is true skin pigmentation. So if you look at all these individuals, this color of the skin itself is darker. And so this is treated differently. There's no surgery for this. This is a little bit more challenging. The causes for this include hereditary. There's actually an autosomal dominant gene that does predispose some people to hyperpigmentation under their eyes. This isn't the reason for all of it, but there is a cause for that. The majority of the cases, though, are due to inflammation or irritation. So this could be as a result of allergies. This could be the result of actually the tears rubbing in and kind of staying and irritating the sensitive skin under the eyes. Certain makeup that you don't even realize that you're allergic to after repeated use. Certain eye makeup can actually cause pigmentation around your eyes. And then, I hate seeing people kind of rubbing their eyes when they're removing their eye makeup. It's so important that you treat that delicate skin so gently and dab everything off. Even if it takes you 10 minutes to take off the eye makeup, your 45-year-old face will thank you for it if you take care of that area when you're in your 20s and your 30s. Then increase vasculature to that area, whether it's from breathing issues or allergies, like I had mentioned before. Lack of sleep can also give this appearance of dark under eyes. And then lifestyle habits such as smoking, sleep, and nutrition. There have been cases of iron deficiency, thyroid issues, and other vitamin deficiencies that have given the appearance of dark under eyes. So the way to treat that is primarily with the skin brightening cream, incorporating retinoid to that area, as well as the ingredients that I had mentioned before. These are some over-the-counter, gentle or relatively gentle products that incorporate some of these ingredients, such as arbutin from The Ordinary and the Inky List. And then Paula's Choice has a good azelaic acid. Again, it's 10%, which is pretty safe on our skin. You don't want to use a 15%. And then, you know, hyperpigmentation, true hyperpigmentation of the under eye area is quite difficult to treat, so a lot of people need to rely on makeup. One thing that a lot of South Asians, I think, make a mistake of is, you know, you have a dark circle, you put concealer on and try to cover it that way. And what happens is you can still see the darkness through the concealer. So it's important that you color correct before you put the concealer on. So you want to use either a red or orange tone color corrector first to balance out the purple or the blue or the red, and then put a brighter concealer over it, like a yellow-based concealer over it. And then the third cause is due to hollowness. So especially these two actresses, you can see the woman all the way on the right. I am not into Bollywood at all, so I don't know who these actresses are, but they are actresses. The woman on the right, she's got a hollow, but there's no pigmentation at all, but it's the hollowness that makes it look like her under eyes are darker. And then the two women on the left, they have hollowness with a little bit of pigment as well. So when the under eyes look dark because of the hollowness, you actually want to build up the hollowness to the cheek so that now it doesn't look as hollow. And the reason it looks dark is because the hollowness doesn't absorb, it absorbs light, it doesn't reflect light, so it looks dark because it's in a shadow. So you want to build that shadow up so that it's even. So in these two patients of mine, we were able to do that with filler. You can also do it with fat, which is a little temperamental, but filler is a pretty easy way to do it, where we just build up that hollowness and now their under eyes don't look quite as dark. Which takes us into the idea of plastic surgery in the South Asian population. So it is very common for South Asian women and men to undergo plastic surgery in the US and abroad. And in fact, India repeatedly ranks as #4 in plastic surgery worldwide. And I would think that people that aren't in this field would be surprised by that number, because I think of all the different groups that we work with, South Asians are the most secretive when it comes to plastic surgery, at least the older generation. Patients in the 20s and early 30s are much more open about it, and actually quite open about it, but patients in the late 30s, 40s, and above are much more secretive about it, although it's quite rampant. And the procedures that are more common include rhinoplasty, eyelid surgery. There's a lot of liposuction, tummy tuck. I know there was a talk earlier in the day about diastasis, and that's a common reason for a tummy tuck procedure at some point if a patient feels like there's only so much exercise can do and they're still not happy with their results, and the tummy tuck is an option. Breast augmentation and breast reduction are very common procedures. Facelift is actually common in South Asian populations because, like I mentioned, although we don't wrinkle, we do sag much more commonly than a lot of our Caucasian counterparts. And then Botox and injectable fillers are exceedingly common in pretty much every age demographic in the South Asian population. One thing I do want to say is, you know, the younger generation is definitely much more they've kind of embraced the idea of plastic surgery, or at least embraced the idea of other people doing plastic surgery, whereas there's definitely a stigma in the older population where they're doing and they don't want to tell people that they do it. And I think, you know, the way I see it, and a lot of the way that most patients see it, is this is it's not about vanity. It's really about doing something to improve your confidence. So that's the thing that I hear repeatedly from patients is, you know, I would never let someone take a picture of me from this angle because I felt very insecure about this, you know, this aspect of my nose or whatever it is, or I didn't feel comfortable in the clothes I was wearing. And this procedure was really life-changing in a lot of ways because I feel so confident going up in front of all these people and giving a talk, or being in front of the board, or whatever it is. It's really about empowering oneself to take ownership of their confidence. And so I think the younger generations really feel that, but the older ones don't. And what can be troublesome with that is I think there are a lot of young women who, feel like, well, this person has like an amazing nose and it was natural, whereas, why not me? Or like my aunt has this great nose, why not me? And they don't know that your aunt had a rhinoplasty or your aunt did this or that. And so I think that transparency is really important for the mental health of the younger generation as well. So again, one of the most common surgeries is rhinoplasty. These are Bollywood and South Asia, Pakistani, and Indian celebrities who have been rumored to have had rhinoplasty. I'm not going to comment on whether they have or not, but have been rumored to have rhinoplasty. And so there are two different ways that you can achieve a change in the shape of your nose. One is surgical, and the other is non-surgical. And the way to do it non-surgically is with fillers. So a couple of these are non-surgical, so you can, I don't know if you can't see my pointer, but basically someone has a hump, you can put filler above or below to kind of camouflage the hump and give the appearance of an elevated tip. And then the young woman on the left bottom, she's got a bulbous tip. That is not something, bulbous meaning like a rounded tip. That's not necessarily something that could be addressed non-surgically. So she ended up having a surgery for that. So there are different ways to achieve that. Now, how South Asian skin ages differently than Caucasian skin. Again, as I mentioned, we're less prone to wrinkles, but we are more prone to sagging, especially in the jawline, the neck. Our aging presents first around our eyes in terms of volume loss and pigment issues. And it actually unique to South Asian, certain Asian populations and certain African populations is we actually can develop some volume excess, unlike many of our Caucasian counterparts. So our faces sometimes get bigger as we age rather than smaller in some cases. So I always believe that prevention is better than treatment if you can prevent. So one way to prevent is really with a simple anti-aging skincare routine. So this is, I think, like the bare minimum of what you should be doing. So in the morning, cleanse, and you actually don't have to use a cleanser. I know this is going to sound like hearsay, but you can just wash your face with just water in the morning if you don't, if you don't have oily skin or if you don't feel like your skin needs to be washed in the morning. I drool all over myself in the middle of the night. I have oily skin, so I definitely have to wash my face with a cleanser, but you absolutely do not have to wash your face with a cleanser in the morning. And if you do use a cleanser, make sure it's a very gentle cleanser. There's no reason for your skin to feel dry and tight after you wash it, and actually it shouldn't feel dry and tight after you wash it. And in the morning, you should use a vitamin C product to prevent any sort of damage throughout the day and to protect your skin. And then you follow that up with a moisturizer. It does not have to be a fancy moisturizer. You can buy a $4 moisturizer from the drugstore and it'll work just fine. And then you finish it off with sunscreen. In the evening, you definitely have to wash and cleanse. And in the evenings, you should, depending on how much makeup you wear and how thick your sunscreen is, you should consider doing a double cleanse. And if you don't know what a double cleanse is, that means using an oil-based cleanser first and then a water-based cleanser, because a lot of makeup and a lot of sunscreens do have oil-based products in them. You want to use an oil-based cleanser to remove the oil-based product, and then a water-based cleanser to remove the water-based products. That's why sometimes when you're removing makeup, you feel like you're not getting it all out, and rather than using a water-based cleanser over and over again, you're just stripping your skin. Doing that two-step technique will really help get everything off and leave you looking clean. And then following the cleanse with a retinoid and then a moisturizer at the end. Again, you want to avoid using too many products. I know a lot of people like there are different types of acids. It's really not necessary. Keep it simple. Just a quick note on retinoid. I don't know how many of you are already using retinoid. If you're not using it, you want to start with a low dose and slowly work your way up. To a lot of my Caucasian patients, I recommend working their way up to 0.1% prescription strength. I don't think it's necessary for a lot of South Asians to get up to 0.1. I think 0.05 is fine for a lot of South Asian patients. You want to start in that calendar I'm kind of demonstrating. You want to start once a week, do it twice, then go to twice a week. Do it once a week, do that for 2 weeks, then go to twice a week, do that for 2 weeks, and then slowly work your way up to every night. If at any point you feel like your skin's getting irritated, then you back off and go to what you were doing the week before until your skin feels ready to move up. If it's irritated, the retinoid can be mixed with moisturizer until you get used to it, or you can actually use it after the moisturizer. It won't be as strong, but it'll still work if you use it after the moisturizer. I think one of the most common mistakes that patients make when they're using retinoid is that they apply it on skin that's still a little wet. It's really, really important that your skin is completely dry, bone dry before you put the retinoid on, because any little bit of moisture will make the retinoid penetrate deeper, and it can be quite irritating. So you want to wait a few minutes after you've dried your skin. If you have dry skin, moisturizer is really important. Even a balm or an ointment like Aquaphor can be beneficial over the moisturizer to trap the moisture in. A lot of people like hyaluronic acid. You don't have to use it, but if you want to use it, make sure you're using it correctly, which means using it on slightly moist skin. Hyaluronic acid likes to pull moisture from the area around it. So if you use it on dry skin, it's going to pull the moisture away from your skin. So make sure it's slightly moist. You put the hyaluronic acid on, and then you want to make sure you seal it in with a thick moisturizer. Otherwise, it will not work as well. Then patients with oily skin, there's some great products or ingredients to look for. Niacinamide is great for oily skin. Squalene is a product that's great for oily skin. The Ordinary has a good squalene. Paula's Choice has a good squalene. For those of you that like using oils, you can actually use oils with oily skin. They aren't very greasy, but they'll give you that glow. Rosehip seed oil is a great oil as a facial oil, won't break you out. And jojoba oil is another one that is a great facial oil. And then niacinamide is great in oil form or otherwise for oily skin. What to avoid? Makeup wipes. These are not good for the environment, and they're not good to remove makeup because you end up just moving your makeup around. But more often than not, I just see people just rubbing their eyes in sensitive areas with these makeup wipes. So just get rid of them. They're not good for you. Avoid lasers again. Even with your hair removal lasers, make sure you go to someone that has treated your skin type before, because I have seen horrible burns, long-term hyperpigmentation lasting years and years as a result of improperly performed lasers. You want to avoid harsh peels. Gentle peels are fine as long as they're performed by a medical professional that's familiar with your skin type, but avoid any harsh peels. We talked about microneedling. Don't do any at-home microneedling. Don't use a retinoid a week before waxing or any hair removal procedures. You can actually end up with scarring as a result. Don't use too much of anything, and don't use a strength that's too high of any product. And hot water. So I love my hot shower, so it's really hard for me to give this advice to people, but I always try never to wash my face when I'm taking a hot shower because it is very stripping and damaging. And like I mentioned, any sort of irritation, redness can lead to hyperpigmentation. So I always make sure I wash my face with either cool water or lukewarm water, but never hot water. And we talked about this. Again, avoid, these are the types of things that can happen with using hydroquinone for too high doses, or using non-regulated skin bleaching creams. So they can lead to patchy hypopigmentation. These are white spots, or can thin out your skin long-term, and they can cause a rebound hyperpigmentation, which is worse hyperpigmentation than what you started off with. And then final thoughts, as South Asians, a lot of our beauty ideals are based off of Eurocentric views, and I encourage all of you to embrace how beautiful and different our skin tones are, how beautiful and different our nose shapes are. And I hope that you were able to see that, even these celebrities have under eye circles, and they have under eye circles that present it in different ways. So we should normalize a lot of this and not really compare ourselves to these Eurocentric ideals. It's fine to want to better yourself in some way and to feel more confident in your skin in a lot of ways, but we also want to be mindful of not wanting to emulate a different race altogether. Thank you for your attention. If you have any questions, you can reach out to me on Instagram or on TikTok. I'm Dr. Sarmela Sunder, and that's my handle down below.